All right, so looking at our list here, guys, of items that you need to identify off the pig kidney. And you're able to see the blood vessels because they've all been dye injected with the biological company that we use. They put a blue dye in for the veins, and they put in a red dye for the arteries. And it looks like that they may have almost put too much dye in here, but hopefully we can still see everything on the one I picked. Okay, so we'll start right here. So right here, what I'm pointing to, this is the outer region of the kidney, and so this is your renal cortex. So this is the renal cortex right here. If we go more internally, right here, this region is your renal medulla. So renal medulla. And then this structure here, this structure here, this structure here would be your renal pyramids. So these are the renal pyramids right here. Here, 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 all renal pyramids. Now, between the renal pyramids, you're going to have some tissue that goes through that kind of divides the renal pyramids from one another. Those are the renal columns. You also have blood vessels going through that connective tissue of the kidney. So right here would be a renal column, right here's a renal column, right here would be a renal column over here, renal column over here. So if you see a pin between the renal pyramids, like right here, you're like, okay, NITS wants the renal columns. So you'll know that's what I'm looking for on the pig kidney. Other structures to know, kind of right off the tip of where you have a renal pyramid, this area over here would be a minor calyx, or down here a minor calyx. And it's kind of a deeper structure, so I'll do my best to find a kidney that shows that pretty well. Looks like there's excessive amount of blue dye that was put into this for the blood vessels. So this may not be the best choice, but right over here is where you'd find the minor calyx, a minor calyx. It's always going to be in front of the renal pyramid. And where you have two minor calyxes, like here and here, then you would get out to an area that would be the major calyx. And again, unfortunately, this kidney that I picked here doesn't look like it's the best representation, unfortunately. But you can see those structures very clearly on the models, and maybe even the pig kidney you pick might be a little better than this one. All right, when you get over here, this area right here then is the renal pelvis. So again, you have urine that goes to a minor calyx, to a major calyx, to a renal pelvis. So this area over here would be a renal pelvis. Again, it looks like they put excessive amount of dye in here because this area should not be all blue. But this would be the renal pelvis area here, and likewise here. And then the renal pelvis extends outside of the kidney. So what we're seeing here is the renal pelvis that protrudes outside of the kidney. So this is all renal pelvis right here, okay? And when you get to the bottom of the renal pelvis, right here, this is kind of the beginning of the ureter. So this is where the ureter would start right here. But up here would be the renal pelvis right there. All right, other items you need to know off the pig kidney. Right here, this would be the outer covering of your kidney. So this is the fibrous capsule. So if I have a pin to the outside here, I'm looking for a fibrous capsule. So fibrous capsule right here. And then this curved part, this indentation part of the kidney, is the renal hilum. So this is the renal hilum right here. This part of the kidney, you're always going to have your blood vessels coming out, so your renal artery, renal vein, and also your renal pelvis, as here is the renal pelvis right there. Okay, and then for your renal artery, renal vein. So here's a great picture here in pink of the renal artery. So renal artery right here. The renal artery is always going to be superior to the renal vein. And that's consistent even when you look at the models. So renal artery is always superior to the renal vein. And then for the renal vein, ooh, it's not looking real promising for that, is it? Ah, here it is, okay. So right here, this isn't the best, but this is where the renal vein would be. It looks like the way they severed quite a bit off, but the renal vein would be situated about right here. Okay, so renal artery right here, and then actually right there, you can see it. Right there would be your renal vein right there in the blue. So right here is the renal vein right there. So there we go, renal vein right there. So those are the parts of the kidney that you need to know. There's probably some better examples hopefully back there for you to take a look at. But if you're feeling comfortable already, again, it's up to you if you want to get one out, but they are kind of fun. And I think all of them back there have already been cut, actually. I think I might have already cut all those. But you never know, there might be a couple here or there that can still be cut in half. Any questions about the pig kidney? You guys want me to go through it again, or are you guys getting a good gist of where all the parts are?
I feel pretty good about it.
Okay, everybody feeling pretty comfortable? Okay. All right, guys. So you have a lot of time to go over the models. There's labels up here if you want to use the labels. And again, if you do want to dissect the pig kidney, they are back there. Safety glasses are here. There are trays up there that you can use. There's also pins over here. I know some students like to use the pins to identify the structures. And again, if you do dissect the pig kidney, remember, of course, when you're done, your gloves get thrown in the gut barrel up front, and you want to use the disinfectant to spray down your safety glasses. And the trays, you want to make sure to use the spray, the detergent spray near the sink, and then, just like always, you want to go ahead and rinse off the trays and hang them up to dry like you see behind Alexis there. So, all right? And if you have any questions at all as you go through the models, let me know. There's the practice practical setup right behind Jessica, going past Alexis there. And there's 20 questions on the practice practical. And I also have the histology board out for you too if you want to take a look. So, all right. Have fun, guys.